All right, here we go. We're looking at the anatomy of a long bone. The first structure we're going to look at is those two rounded edges you'll see on both sides. So I'm going to indicate those with my pencil here, and both of those edges are called an epiphysis. So if you're learning how to spell it, it might be easier if you remember the term epiphysis here, and it's going to be the same name on this end, epiphysis. Epi meaning beyond, and physis relating to the Greek word for growth. The other term would be that long middle part, sometimes called the shaft of the bone, which is going to be indicated right there. I'm going to take my pen. This is going to be called the diaphysis. Diaphysis. Dia relating to through or beyond a measure of growth. So we'll talk about how bones grow in a second. One important thing to know about the epiphysis is that you want to be able to refer to them by different names. So if you're cutting into a femur or a tibia, you don't want to cut into the wrong end. So these are called the proximal and distal epiphyses. So let's say that your torso or the rest of your body is located in this direction. Since this is closer to that body, this is going to be called the proximal epiphysis. Again, those are anatomical terms, they're just going to keep popping up. And this one would be the distal epiphysis. Another structure here, the last one we're going to talk about this time, is going to be the articular cartilage, or the softer tissue that's going to be located around the joint that helps sort of mediate movement. And when this articular cartilage starts wearing down, you might run into some issues, some symptoms you might see in arthritis, for example. So here, again, this is the articular, relating to where how bones are put together. You articulate a skeleton, you disarticulate it when you take it apart. Articular cartilage. There are actually many types of cartilage. This would be different from the type in your ears or your nose. They're both types of cartilage, which is softer bone. All bones actually start as cartilage. Last part, just to make sure that we're sort of getting the colors down to help you emphasize this, I'm just going to color in the epiphysis in red or pinkish sort of on my end, and I'm going to color in the diaphysis or this shaft in yellow. And the significance of these colors is going to come up in the next portion of the lecture, so I like to make sure that you do red and yellow and you don't use different colors. I actually do care for this section. So again, to wrap it up, this is the anatomy. I'm going to use black though. Let's do purple. Anatomy. Whoop, nothing scheduled for tomorrow. Anatomy of a long bone. Most bones have a similar type of structure, but let's be a little bit specific here. We're talking about a specific shape of bone. For example, your tibia would be an example of a long bone in your lower leg, or your thigh bone or femur. Also the long bones in your arm, for example, your ulna, your radius, your humerus, all those bones. This particular structure doesn't apply as much to bones like your sternum or your mandible or your vertebrae, just because they're shaped in a different way. All right? Awesome.